Are you ever driving in your car, listening to music, and you know exactly where you're going, but then you get thinking about something pretty hard and you miss your exit on the highway and you have to take the next exit and turn around? Well, when you are caring for someone with memory issues, it can kind of feel like that sometimes, where you think you're on the right path and then maybe you stop paying attention and you're not sure what exit you just took, or you took the wrong turn because you were so busy thinking about other things. Well, I'm here to tell you that caring for someone with dementia can be so overwhelming. And what I want to talk about today are 4 different options of care inside the home that I often recommend to the clients and families that I work with. The first option is when you're driving on the road and you have, a map of Denver and you're not sure like which direction you're going. And you're not totally certain, is it time to take the keys away from my mom or dad or from my loved one? Should they really be driving? Or I really don't think they should be driving, but I don't know how to get them to stop. One thing I recommend is is a driving safety evaluation that's done by an occupational therapist, and it can be done in your home, where they come to your home, they do a written evaluation with your loved one, they ask them questions verbally, and then if they think it's appropriate, they will take them out behind the wheel for driving. And they'll make recommendations like, I think they should be driving just within a mile radius or 5-mile radius or just to the grocery store. Or they'll say, I don't think they should be driving and here's why. And so here's the information to present to your doctor and the DMV. That's one thing that I know people worry about a lot, and driving safety is huge and it's really important. So it's one thing I sometimes recommend to my clients. Another common thing that I recommend is an evaluation with a speech therapist. The reason I would do that is because sometimes in this map, we don't know exactly where our loved one is. Are they in the really early stages of Alzheimer's disease? Or do they have more moderate middle stages of some other kind of disease causing dementia, like frontal temporal dementia or Lewy body dementia? There are lots of diseases that cause dementia. Or are they really in the late stages? Because I think they've just declined so much in the last 6 weeks or 3 months. A speech therapist can give you a clear grip on this is really where they're at in terms of their stage of dementia and how we need to care for them because of that. So they'll kind of give you a rundown of what this person is really capable of and not capable of, and then give you some advice in caring for them. As a caregiver, you need to be mindful of these 10 things, or they really need help with these things, but not with these. And so that speech therapy evaluation can really help us know cognitively where is this person at. And so therefore, how do we take care of them best? Whether that's with caregiver interaction or with treatment or with medications or with a living environment that's different than where they're at now or the same. A third thing that I recommend to people often when it's appropriate for their interests and expertise and their passions is music therapy. Okay, so music therapy is a really great service that people can get in their home, and it uses, therapists use the use of music to add to someone's physical, emotional, cognitive, and social well-being. They work with individuals and sometimes they'll work with a group, and it's really involves kind of creating. It could involve singing, it could involve moving to music, and or just listening to music. And these music therapists are really skilled in engaging that person in their love of music. It's also an avenue for communication for those that find it really hard and difficult to communicate and express what they want to express in words. The The last thing I often recommend, and sometimes recommend, is a life alert button. So that is on your wrist, they have buttons, or they have a necklace that you can wear on your neck that you press if you fall or if you need help or you have a medical emergency. So that people that live alone and are concerned about that can wear this all the time and know that they're covered if in the middle of the night they have a fall and they can't get up, or they injure themselves, or they are experiencing, heart palpitations and they're really worried they need to have an ambulance come. They can just press their button. And so that's a fourth thing that I recommend to people for services they can have inside of their home that are not caregiver services. So I hope this is helpful. If you have any questions or want a specific recommendation from me in the Denver metro area on any of these services, please feel free to reach out. I'm Jenny Reynolds with Graceful Guidance Care Management, and I'd be glad to provide this information to you. So thanks and have a great day.